Hello everyone, in this session we'll be learning about the brainstem, the cerebellum and the cranial nerves related to it. So here there is a specimen of the hind brain which includes the brainstem on the anterior aspect and the cerebellar hemispheres on the posterior aspect. First of all, for holding it in anatomical position, we have to hold it in such a way that the superior surface of the cerebellum is here and the brainstem is on the anterior aspect. Okay. So in the cerebellar hemisphere, first we should identify which part is superior and which part is inferior. So how to do that? If we see the superior surface of the both cerebellar hemisphere, it should look continuous with each other. Okay, when we see the superior aspect. Because when we see the inferior aspect, we can see a deep notch which is there between the two cerebellar hemisphere. Okay, that is referred to as the cerebellar notch, which is seen clearly on the inferior surface. So on the superior surface that notch is not seen. That's how we can identify which part is superior and which part is inferior. Okay. First let us look at the cerebellum, then we'll see the brainstem. The two cerebellar hemispheres are connected by a midline structure called as vermis. Okay. So this is the region of the vermis. So this is referred to as the superior vermis. And when we see on the inferior aspect, this part that we can see, that's the inferior vermis. Okay. Then the different fissures are seen. Just like the cerebrum has got sulci and gyri, the cerebellum has got folia and fissures. Okay, folia are the projections, fissures are the depressions. Okay, so there will be multiple folia and fissures like this. The projections are referred to as folia. In between them, that's the fissure. Okay, so three prominent fissures have been described on the superior surface. At the junction of the anterior 2/3 and posterior 1/3 of the superior vermis, there is a fissure that is referred to as the primary fissure or fissura prima. Okay, so the most prominent fissure that is seen on the superior surface is referred to as fissura prima. Okay, that divides the cerebellum into the anterior lobe and the posterior lobe. Posterior lobe is also referred to as the middle lobe of the cerebellum. Okay, so there is an anterior lobe and middle lobe separated by fissura prima, and there is one more fissure prominent, but it is not separating the lobes. That fissure is horizontal fissure. Okay, so here we can see the horizontal fissure of the cerebellum. So this fissure that we can see here, and continuing with the other side. Okay, so to how to identify horizontal fissure, identify the middle cerebellar peduncle, and there is a fissure in line with it, that is the horizontal fissure. So trace it and then you will be able to trace it with the other sided middle cerebellar peduncle. Okay, so that's the horizontal fissure that separates the superior surface with the inferior surface. Okay, superior and inferior surface are separated by horizontal fissure. And there is one more fissure called as posterolateral fissure, that's between the flocculonodular lobe and the middle lobe. Flocculonodular lobe is not seen clearly, only the nodule part is seen, but there will be one more fissure here that is referred to as posterolateral fissure. Okay, so three fissures, and the lobes are anterior lobe, middle lobe and flocculonodular lobe. Okay, and apart from that, there is one more prominent feature of the cerebellum that is seen here, that is referred to as the cerebellar tonsil. Okay, this part is referred to as cerebellar tonsils on each side. Okay, cerebellar tonsils. This is the part of the cerebellum that herniates through the foramen magnum when there is increased intracranial pressure. Okay, so it's important to identify this part. And when we take a section of the cerebellum, a horizontal section, when we take, we'll be able to identify the intracerebellar nuclei, the most prominent of which is referred to as the dentate nucleus. Okay, there are four nuclei from medial to lateral: vestigial nucleus, emboliform nucleus, globose nucleus, and the dentate nucleus. Okay, so that you will be able to see in the section. And about the arterial supply of the cerebellum, for the superior surface there is an artery called as superior cerebellar artery, and on the inferior surface there are two arteries. One artery is in the front and one is behind. One in the front is referred to as anterior inferior cerebellar artery, and one behind is referred to as posterior inferior cerebellar artery. Okay, we should know that these arteries are branches from which artery? Superior cerebellar artery is a branch from the basilar artery. Anterior inferior cerebellar artery is also a branch from the basilar artery, and posterior inferior cerebellar artery, it's a branch from the vertebral artery. Okay, now let's look at the specimen of the brain stem. Brain stem has got three parts. The upper part is referred to as the midbrain. Okay, this part is the midbrain, and there is pons. The lower part is the medulla oblongata. Okay, so three parts of the brain stem we need to identify. And brain stem section has been taken here, so an important feature is seen. Let's see that. So when we take a section of the brain stem, and you see this black colored area. Okay, this black colored area here, that's the substantia nigra that is seen. Okay, substantia nigra, a part of midbrain, substantia nigra. In front of it, the area is referred to as crus cerebri. Okay, in front of substantia nigra is crus cerebri. Behind it, this area is referred to as tegmentum of the midbrain. Tegmentum. Up to the region of this cerebral aqueduct. Okay, this is the opening of cerebral aqueduct. Draw an imaginary horizontal line here, behind which the area name is tectum. Okay, tectum has got the four colliculi. The two superior colliculus, two inferior colliculus, together they are referred to as corpora quadrigemina. Okay, that is present in the tectum region. The intermediate area is tegmentum, then substantia nigra and crus cerebri. These three together, tegmentum, substantia nigra, crus cerebri together, is also referred to as cerebral peduncle. Okay, so cerebral peduncle is a broader term. Many a times students get confused between cerebral peduncle and crus cerebri. Okay, so crus cerebri is actually a part of the cerebral peduncle. Okay, cerebral peduncle includes the three components: tegmentum, substantia nigra, and the crus cerebri. Okay. In between the two crus cerebri, there is a space here that is referred to as interpeduncular fossa. Okay, interpeduncular fossa, which lodges the circle of Willis. Okay, it's arterial supply of the brain. There's an important component called as circle of Willis, which is present in the interpeduncular fossa. Okay, so this was about the midbrain. Now let's look at the pons. Pons, when seen on the anterior aspect, on the midline it shows a groove that is referred to as basilar groove. Okay, there is a groove on the pons in the midline that is referred to as basilar groove. Okay, and there are horizontal multiple striations that are seen here. Those are referred to as horizontal transverse striations on the pons. These are produced due to the underlying pontocerebellar fibers. Okay, pontocerebellar fibers run horizontally. Okay, actually the fibers actually come from the cortex, so it is also referred to as cortico-pontocerebellar fibers. So those fibers running horizontally going towards the cerebellum, they produce this horizontal transverse striations on the anterior aspect. And on the anterior aspect of the pons, there is one nerve seen prominently that is referred to as the trigeminal nerve. Trigeminal nerve that marks the junction of the pons with the middle cerebellar peduncle. Okay, so junction of pons and middle cerebellar peduncle, it's demarcated by this trigeminal nerve. Okay, now let's look at the medulla oblongata. So medulla oblongata, anteriorly in the midline there is the anterior median fissure. Just adjacent to it, there is an elevation called as pyramids. Lateral to it again, there is an elevation called as olives. Okay, and more lateral to it, again there is a white matter that is referred to as inferior cerebellar peduncle. Inferior cerebellar peduncle. Okay, there are three cerebellar peduncles which is connecting the brainstem to the cerebellum. From the midbrain to the cerebellum is superior cerebellar peduncle. From pons to the cerebellum is middle cerebellar peduncle. from the medulla oblongata to the cerebellum is inferior cerebellar peduncle. Okay, and there are sulci in between them, between these pyramids and olive. There is a sulcus here that's referred to as the anterolateral sulcus, and there is a sulcus here between the olives and inferior cerebellar peduncle that's called as posterolateral sulcus. Okay, so all these features are seen on the anterior aspect of this brainstem, midbrain, pons, and medulla oblongata. For midbrain, we saw some part of the posterior aspect as well, the colliculus. Okay, and posterior aspect of pons and medulla oblongata together, they are seen as the floor of the fourth ventricle. So we'll discuss that in a separate specimen. Okay, now let's discuss about the cranial nerves related to the brainstem. So cranial nerves, if we see, there are 12 pairs of cranial nerves, out of which except the first two cranial nerves, except olfactory and optic, rest all cranial nerves are related with the brainstem. Okay, so brainstem is a very important topic as far as cranial nerves are concerned. Okay, so which is the third cranial nerve? The oculomotor nerve. Okay, oculomotor nerve, we can see some fibers here. This is the oculomotor nerve arising from the anterior aspect of the midbrain, and there is one nerve arising from the posterior aspect of the midbrain, that is the trochlear nerve. Okay, so two nerves related with the midbrain are oculomotor nerve and trochlear nerve. Okay, this one is oculomotor, and this nerve here is the trochlear. Okay, so two nerves are related with the midbrain, oculomotor nerve, that's the third nerve. Fourth cranial nerve is trochlear. Okay, trochlear is the only nerve that arises from the posterior aspect of the brainstem. Rest all cranial nerves are arising from the anterior aspect. Then the fifth cranial nerve we had seen while describing the pons. This one. This one is the fifth cranial nerve that is seen on the anterior aspect of the pons. It marks the junction of pons with the middle cerebellar peduncle. Okay, that's the fifth cranial nerve, trigeminal nerve. Then sixth, seventh, and eighth. All three are present at the pontomedullary junction. Pontomedullary junction. So where is the pontomedullary junction? So junction between the pons and the medulla oblongata towards the midline. This nerve is the sixth cranial nerve. So this one is the sixth cranial nerve, abducens nerve, and this nerve here, that's the seventh cranial nerve, and the lateral most is the eighth cranial nerve. Okay, vestibulocochlear nerve. So pontomedullary junction. Medial aspect is abducent nerve, the sixth nerve. Lateral aspect is seventh. Seventh nerve is facial nerve. Eighth nerve is vestibulocochlear nerve. Okay, all three nerves are present at the pontomedullary junction. Okay. Then the last four cranial nerves, 9, 10, 11, 12, all are related with medulla oblongata. Okay, in the medulla oblongata, there is a sulcus here that's referred to as the posterolateral sulcus, which has got rootlets of 9th, 10th, and the 11th cranial nerve. Okay, we can see multiple rootlets here. So these rootlets are actually coming from the posterolateral sulcus of medulla oblongata. These are 9th, 10th, and the 11th cranial nerve. And this sulcus here, that's referred to as the anterolateral sulcus. This will have rootlets for the 12th cranial nerve. Okay, that's the hypoglossal nerve. Should know the names of these nerves as well. 9th cranial nerve is glossopharyngeal, 10th is vagus, 11th is accessory. Okay, so 9, 10, 11 arising from posterolateral sulcus, 12th arising from the anterolateral sulcus of the medulla oblongata. Okay, so this was about the external features of the brainstem, cerebellum, and the cranial nerves related to it. There is a separate video on the different sections of midbrain, pons, medulla oblongata on this YouTube channel. Kindly go through it because sections are more frequently asked in your exams, and various applied anatomy related to it also I have covered in that, and also PDF handout for that is available. For that you all can WhatsApp me at this number, and please do watch other sessions of this YouTube channel. Thank you.